Really exciting session that we have planned for the next hour with Lucy and Trish from Midlands Partnership NHS Foundation Trust. And we're going to be talking about the sparkle of inclusion, unveiling digital angels in healthcare. For those of you who might not have come across the DPA before, hopefully you have, but if not, we are a charitable coalition. So we bring together lots of different sectors, whether that's government, whether it's industry, whether it's healthcare, whether it's education, around our central goal of ending digital poverty once and for all in the UK by 2030. And we do this both through advocacy, including campaigning and sharing best practice like we're doing today, and also through delivery, so helping families and households around the country get access to kit, connectivity and skills to help them on their digital journey. Today, as I say, we're going to be hearing about this in a healthcare setting. So Lucy, Trish, could I ask you each to introduce yourselves?
Yeah,
do you want to go first, Trish?
Yeah, I'll go. So it's Trish Nolan. I'm Head of Digital Skills and Business Change for Midlands Partnership Foundation Trust.
And I'm Lucy Roberts, and I'm the Digital Skills and Business Change Lead for Midlands Partnership.
Fantastic. Thank you. If you are listening in live today, do please use the chat. Let us know who you are, what organisation you represent, where in the country or indeed the world you may be today. And do remember at the bottom of the screen, there's a little Q&A button that you can press. If you have any questions as we go through the session, please do pop them in there and we will try and come to as many as possible of those towards the end of the session. So let's kick off. And please, whichever of you wants to contribute to any of these questions, do dive in. Now, in the Midlands, you've been doing some fantastic direct work to really practically help people to get online. How has the distribution of both devices and then also SIM cards through your community outreach programs impacted healthcare accessibility in the communities that you serve in the Midlands?
So one of the things we've done is tried to attend as many community events as we can. So we tend to go to health and wellbeing events. We do drop-in sessions at local libraries. We've recently connected with GP practices. And as part of those events, we encourage the community to download the NHS app and show them what they can do on that app itself. We encourage people also to use the NHS website to look up information. And another thing that we've used are comp devices. So these are devices where if people are digitally excluded, they can have, it's like, I always call it, it's a bit like a big Etch-a-Sketch, I call it. So it's like a big screen, and it's very simple to use. It's just got one button, but they can have that in their house and they can use that for video consultations with our team. But they can also use it because sometimes, a lot of the time, these people have no way of connecting with family. So their family can download an app and they can actually make video calls to them, which is really nice to see, because sometimes these people have never made a video call. And I mean, we've had service users in tears, haven't we? Because it's the first time they might have seen a relative that's perhaps moved to Australia or something, and they're able to have a video call with them. So that's really nice to see. I think one thing for us is it's just a really rewarding role to do, isn't it, Liz?
Definitely. And I suppose the comp devices, they were rolled out during COVID. And for a lot of people, this was probably the first time that they've been able to sort of connect and speak to their families. So we've currently got 120 devices that are in use. And, you know, it's been really rewarding to obviously support those families as well to get connected. And the same with the NHS app as well. We found that these drop-in sessions at the GP practices, it's really accelerated, you know, the knowledge and obviously use of the NHS app. We go there, we install it, we give them one-to-one support on how to use the app as well. And you know, that's really made a difference. And I think I saw something recently that obviously the new figures show obviously that there's about 34 million people that have registered as a user of the NHS app. And obviously the login rate has risen by 79% in the last year. So it's just great that, you know, we can, obviously we've not done a million, but, you know, we've done quite a, you know, a good amount of people as well for the NHS app.
The other thing, Lucy, which you got heavily involved in, was it where patients couldn't be discharged from the ward because they didn't have a mobile phone? So do you want to talk about that as well?
Yeah, so obviously our trust is both for community and mental health. So we had inpatient wards where we had staff that you know, were needing to discharge patients that were fit to go out in the community, but they have to have follow-up care and conversations with their healthcare support workers. A lot of them, they couldn't be discharged because they haven't got a phone or a SIM card. So we've been able to provide that for them to obviously get the care and support they need in the community.
Some amazing examples there, and actually things that people wouldn't think of. Certainly I wouldn't have realised a patient wouldn't be allowed to be discharged if they didn't have access to mobile connection. And of course, it's not just about the patients as well. It's also about the staff within what's really quite a large organisation. Could you tell us a bit about your approaches to ensure digital inclusion there, particularly those who are maybe on lower pay bands or older staff members?
So again, so one of the things we identified, we did a staff survey to identify the skills of our staff, because we're very aware that in particular staff on the lower pay bands have lower digital skills. So that identified that we needed to provide one-to-one support for I think we had about 146 staff that we identified that we could do a one-to-one program with them. And Lucy's been heavily involved again in working with those individuals and putting a plan together. But what we try and do is, because what you don't want to do is make people scared or run off because they're scared of the technology, or so what we try and do is we try and only give them the skills that they need to do their job, but then also we try and teach them some skills that they can use in their home life. So again, we've actually turned people's attitude to digital around. Like, we've had staff come to us and say, I don't want to learn about IT. I don't want to use a computer. You know, I'm not interested. I'm too old, or whatever, or it scares me. But by working with them, we've actually turned their attitude around, where we've had staff, haven't we, where they have gone out, they've paid to get on the internet, they've gone and bought a computer, and then the next thing they're looking up how to do different knitting things on YouTube or whatever, because it's suddenly they've seen the use for it in their work and their social life. But I mean, we put a bid into the Good Things Foundation for SIM cards, which we won at the beginning of the year. And what we do is we distribute those SIM cards to both our staff and service users.
Yeah, I think obviously working quite closely with quite a few members of staff on the one-to-one training, we've just found that there is a real need for it. So we had two ladies, you know, that really were scared of IT. They thought pressing the button to turn it on would maybe blow it up, you know, and it's quite distressing sometimes to see these people, because they get really frustrated and stressed and upset. And a lot of these staff members that we've helped to support would have actually have left their jobs because of maybe the digital technology, just because they didn't know how to use it. And I think obviously, you know, everything is going digital, and we need to make sure as an organisation that we are being inclusive to everybody, and obviously upskilling and, you know, supporting them, not just at work, but also at home. you know, because you know, the lady who loved to knit, you know, YouTube has opened up so many different boundaries and, you know, experiences for her. So it's really worthwhile.
And this is it, isn't it? This is absolutely at the core of people wanting to get online or to learn digital skills. It's about something that's really relevant to them and what they want to do and what they want to achieve. I'm sure that it's not all necessarily been quite as simple as it possibly sounds from here. What are some of the challenges that you have encountered while you've been implementing some of these digital inclusion initiatives, and how did you overcome those?
I think one of the biggest challenges for us was managers not giving staff the time off to attend training. And that's one of the reasons why we launched the Digital Angels, because we just thought, well, if they can't come to us, we could go to them. So we do a lot more floor walking now and visiting off. I mean, we've got over 200 different offices and locations. So we get ourselves out there, we find those staff, and you often find as well that that these people are hiding as well away from, they don't want to hold their hand up and say they haven't got the skills, or they're struggling. So we have to go and hunt them down and find them. And when we do, we support them. And that's why we call ourselves the Angels, because we're there to make life better and easier for them and make them more confident and give them the skills that they need. And like I say, because we relate the skills to both what they do at work and how it can help them at home, I think then they're a lot more interested in learning those skills. And also what we found is, although initially when we've offered to do one-to-one support for staff and their managers have said, no, we can't afford to release them for that time, what they've actually found is, actually, because they've spent the time having that training, they've now got a more confident staff member, they're now off sick less, they're now enjoying their job more, and actually, I've got somebody else, can I send you somebody else to train as well? So it's been quite interesting seeing the turnaround in managers' attitudes as well.
Yeah, it's been like, I don't know, like a ripple effect. So we started off with maybe 2 staff members that we were supporting, and then it was, oh, do you know, we've got this digital angel that comes in and they offer this support, and you know, and I think that's how it's really worked out. I mean, it is difficult. It's not plain sailing all the time. Some staff members that we train, and I will say to them, it doesn't matter how many times I train you on the same thing, we can do it week in, week out. It's just until it sits comfortably with you. And you know, they're like, oh, but I'm wasting your time. No, you're not wasting my time or anybody's time. We want you to learn, and that's the thing, is we're not there to get them to learn it in a day. You know, we go back, we make regular visits to them, and I think that's how it's really worked. But that's been a challenge for us, because we've become so, you know, popular within the trust, the digital angels. Everybody wants a digital angel, that our team has also had to grow with that demand, because there is such a demand, and from what we're doing, it's getting out there and, you know, doing it, you know, not being sat at home. And I think that's been great for our team morale as well, because we all love our job. And actually we love getting out there and supporting people, and it's really sort of you know, increased, I don't know, our work satisfaction, I think, because we are making a difference. I mean, it sounds really cheesy, we say, oh, we're changing lives, but actually we are. You know, both staff, service users, people in the community that aren't even associated with Midlands Partnership, you know, we are making a difference and changing their lives.
I think also they can see we're friendly, we're approachable, and like I say, we're not just going to come once and show you and walk away. We're going to keep coming back until you're confident and you're happy. And also, we don't talk in techie talk. You know, we make it simple, don't we? We know, we break it down. We learn a bit each week. We're not going to try and teach you everything in a couple of hours. So yeah, makes it good.
And it is true how transformational this kind of support is, and being able to realise that that's something that you've done, you've helped with these people to be able to access really a whole new world, must be incredible.
Yeah.
How do you measure that success and that effectiveness within the trust? Do you have sort of metrics that help you to do that?
So we have done staff feedback surveys, and with all the staff that we train on a one-to-one basis as well. We've done surveys to get feedback from them. I mean, just from talking to people as well, when you're talking to them on a one-to-one basis, you know, you've gone from somebody who may be going home and crying every evening because they're that, you know, worried about using the technology and being able to do their job, and then you can see that after they've had that one support and they've had that training and they've had that weekly input, and they know we're not just going to train them once and leave them in the lurch. And then you speak to them 10 weeks down the line and they're like, this is, you know, I'm a lot more confident. I'm not going home crying every day. So you get that feedback after you train them directly, don't you? And you see them grow. And like we say, we see other people come to us and say, oh, you know what you've done with Margaret, can you do it with me as well, because that looks really good and I'd like to, you know, feel more confident at doing my job and I'd like to learn those skills. It's the same with the community stuff we do, isn't it? You know, we started, I mean, Lucy started the library sessions in our local library. I mean, I think you had one person come up on the first, but they gradually grow and word spreads, and then people go, oh, what are you doing over there? Or, you know, I want to join in and do that. Oh, that looks cool. Look, you know. So all of a sudden, and to be honest, some people probably don't even come for the digital skills. They come for a bit of company and socialising. Yeah. Fine, you know, come along, join us. And by the way, while you're doing your knitting and chatting and having a coffee and a piece of cake, you might actually learn some digital skills, or you might find out something that actually I need to know that as well. I'll pick that up. So
I think that's, so the first library session, set up in Rising Brook Library, and I had one chap come in, Bob. He's part of the community. He recently lost his wife, and for him it was a social aspect. He was really, you know, he hadn't got many friends because he said that his wife made all the friends. So it was his wife's friends. They were sort of his friends as well. So Bob came along, and Bob is still coming along to the sessions. But Bob started that he wanted to try and learn how to use the laptop, because his wife used to do the laptop. And the laptop was quite a scary piece of equipment, intimidating for him. And we got him a tablet, you know, so we got him a tablet and obviously a SIM card in it. And we started to teach Bob how to use the tablet. This has now moved on to Bob's got a mobile phone that we've also gifted to him. And he's able to ring and text. He hasn't seen his daughter for quite a number of years because she lives in Australia. So he's actually been able to use WhatsApp to video call. Now, Bob didn't used to cook. So we got Bob on YouTube, and now he's been able to cook a steak from watching YouTube videos. So Bob is an absolute testament, you know, to our work, really. It's just been really worthwhile, you know, with Bob, you know, but it's grown massively. Obviously, we have got data, we've got Excel spreadsheets with everything, how many people we've supported, how many, you know, tablets, pieces of equipment we've gifted, and who they've gone to, and that's what we do.
Incredible. And it's always so powerful actually hearing about those individual examples, what this has meant, what it's opened up for people to be able to achieve. And I guess you must have a lot of examples of that kind of ripple effect, not just on individuals, but actually in terms of communities. I don't know if you'd like to share some more examples of how that goes far beyond sort of even individual well-being.
Can I do the Orla story, Lucy?
Yeah, you can do the Orla story. Go on then.
Orla Orla is this lovely Polish lady that started coming to the Rising Book drop-in sessions that we were running, and she used to amuse me because she's ever so, every week she came, she'd have specific things that she wanted to learn. So she'd come one week, she'd get a laptop out and she'd go, I want to know how to do this on a spreadsheet. And I'd show her how to do that, and then she'd be like, right, I'm happy now, walk off. And then next week she'd come and she'd have specific things that she wanted to do each week, which I loved because she knew exactly what she wanted. And then once she got that information, she'd go. And the one week she came along and said she was looking for a job and she wanted to write a CV. And at the time we had this one of our digital angels, Bev, with us. And Bev used to work for the recruitment team in the trust. And Bev went, why don't you sign up for the bank with the trust? So next thing, she's on the laptop, sign her up on the bank. And then the next thing, Orla's got a job at MPFT, which is absolutely fantastic because she's gone from someone who's come to our community drop-in sessions and she's now got a job in the trust. So it's just a wonderful success story for us to share.
Yeah. So Orla, she's such a lovely human being. She actually was a volunteer at the library as well. So she would come on her days off on a Friday for us to support her. And she's lovely because, like Trish said, she came with like a notebook as what she wanted to learn. And once she'd learned it, she's like, I'm done now, I'm okay, I'm fine. And then she'd go and then she'd come out next week with a few more queries, and she would write everything down. It was just fantastic. It was such a lovely way to sort of support somebody. And then obviously for her to work in the trust and get a job, it just shows she found it really difficult, obviously, from moving from Poland over to the UK with the whole language barrier. So during the sessions, we obviously helped her with translation equipment to support, obviously digital equipment and things like that. So she used and that quite a lot on there. So the Orla story, we love to say that. It's such a lovely story, and we need to get a video on that one because that will be beautiful, won't it?
Yeah, Ash was just asked the question actually if we have these case studies written up. So we are planning to write them up, but we have got a couple of videos, haven't we? We've got
Yes.
a video of a lady called Joan who works in the trust that we trained up. So we could share that video with you. And we're doing one about Bob, who Lucy talked about earlier as well. And yeah, we want to write one up about Orla as well. So that they're all planned to be done, but we haven't got round to doing them yet. So, but we will show you the Joan video because that's there.
Yeah, I think for us, because we are really busy as a team, and we've got so many ideas and everything like that, and like me and Trish will have a meeting in the morning and we'll say, what happened at the library, and there's just so many different stories. I mean, we've got a library in Heath Hayes that we go to, and we've got a lady that comes along and she's learned a little bit of digital. She's a bit of a skeptic. She'll say, oh, well, I'll sell your data on the internet, that sort of person. And she comes along, she learns a bit, she does knitting then. But she knits whilst we teach other people, and she joins in the conversations. And the one at Heath Hayes has become quite a lovely social event for people. We've got a husband and wife that come along, and technology, they definitely just, they don't want to know. They didn't want to know. They do now. Obviously, because we've won them over. Last week I went along, or the week before, and they were searching for a car on Auto Trader and things like that, and looking to start up a bank account online. And we just gave them advice. We teach people cybersecurity in the community. So, we do it for staff, service users, and people in the community. So these people that we have in the libraries, they're not necessarily associated with the trust. They might just be your average Joe Bloggs that walks off the street. But it's for us, it's just really worthwhile.
Brilliant. Yeah. I can see we've got some hands up as well. Do drop your question into the Q&A because we will be coming to those at the end of the session. So do pop any questions within there. Thinking about as the team as well, and you've talked, both of you, a bit about sort of how that feels being part of the group of people who is making such an impact on both staff and patients. Do you feel like your team and the Digital Angels really play a part in fostering a sense of purpose and fulfillment within the organisation as well?
Definitely. I think everyone in the team's really motivated. Like I say, I think every single day you're changing lives, you're making a difference. I think this has got to be one of the most rewarding jobs. I love my job. I think everyone in the team loves what they do, because I don't know how you could not like it, unless you don't like helping people, I suppose. That could be it. I don't know.
Although I don't know. Obviously, the team has massively grown over the last couple of years, hasn't it, Trish? And our roles have really changed. So before it was classroom training, and it was only just staff. We only focused on training staff, didn't we? And Microsoft Teams training, things like that. But over the last couple of years, it's evolved. It's changed due to definitely, obviously, the digital demand. It's been really, really sort of, pivotal, really, that we've got to move with the times and sort of support, staff, service users, and the community. It's the way the world's going, and we get so many people that come to our drop-in sessions that are worrying about the digital switchover. Obviously with BT and obviously all phone companies, that's being switched over. Is it going to cost them more? Because we're all feeling the crunch as it is at the moment. What equipment do I need? When's it going to be switched over? And obviously, as a mental health trust as well, we need to take into consideration our patients, because some patients don't like things ad hoc and out the blue. They like to have that time to process that information. And I think we really need to get together and plan a way of working with our service users and the community that it's nice and smooth, because that's a massive thing. Everybody asks us about that. What's going on with the switchover? You can see that they are really quite anxious about it. Anything to do with change, people get anxious and worried about that. And we just need to be there to support them and try and get as much information and maybe training as possible, so we can filter that through, to the community, because it's coming, and it's going to happen to everybody. So we need to try and be at the forefront of that, and get ahead of the times and support people.
Definitely. And of course, at the DPA, we've been joining Silver Voices and Disability Rights UK in campaigning for a delay in that switchover, particularly for those people who are older or for whom it will create vulnerabilities, just because actually it feels like the systems aren't there yet. And we know there's a lot of work going on in the background to try and get those systems and support to be functional for those people who are not digitally confident and don't have broadband within their home. Yeah. But it's raising a lot of fears and concerns, exactly as you say. And I guess finishing on a really positive note before we move to the Q&A from our attendees, what are the future plans? What are the aspirations going forward for the trust in this realm of digital inclusion?
I think we want to broaden our spectrum, so we want to work with more local charities. We want to extend the library drop-in sessions that we're doing. We want to do more GP drop-in sessions as well. So basically, it's more of what we're doing, but we want to expand it, and we're also looking at maybe running sessions at local hospitals as well, just basically trying to widen to make us more accessible for both our staff and our service users.
Yeah, I think as well, because obviously we currently do work with charities. So a local one to us is the House of Bread. Obviously, we support them through training. Obviously, we've given SIM cards, also equipment as well. We also work closely with a company called Free IT Stafford. So a hell of a lot of our equipment is donated to them once it's obviously securely wiped, which is changing lives. They've donated to schools and people within the community. It's a referral system. They've actually this morning been to pick up some equipment. So another 86 laptops, I believe it is, and 40 tower drives. I've got some pictures, so I'll put those on Twitter and LinkedIn later. But we've donated a hell of a lot of equipment. But really, actually, it's only a drop in the ocean, because we do know that there's a lot more equipment than we could donate. But it's having the resources and the time to do it. Because this isn't it's not our day job, is it, Trish? You know what I mean? Our role is predominantly to train staff. But as I say, everything's evolved, and ideas. Me and Trish always get together and have got ideas, and we'll go. If it works, it works. If it doesn't, we'll have egg on our face maybe. But you know what I mean. We're there to try. That's that's the great relationship that me and Trish have. We give it a go. And we've got that can-do attitude, and we've had our first session yesterday with Brighter Futures, which they are a housing association, and that went really well. So we're going to be going there every week, on a Tuesday and a Friday, and that's really exciting. As long, it's great because they're like food banks as well. So it's quite a hub for people within areas that are obviously in poverty, as well as we're having a space within a local food bank as well. I was speaking to them in Leek. We just need more staff. We haven't got we haven't got enough staff. We need more people. But the team are amazing, and we absolutely love what we do. And we wouldn't change it, would we, Trish?
No.
And you are award-winning, I know, for that can-do attitude. So the Digital Leaders Awards recently, picking up a trophy, one of many, I suspect, that sit on the collecting mantelpiece.
Yeah.
We've got some fantastic questions that people have shared. Do keep them coming in, because we've got a little bit of time. This one from Jess Flack in Essex. He's something that I know has come up a few times in different forums. Do you see nuances in some of the features enabled by GP surgeries on the NHS app, or indeed even GP surgeries using different apps to support their work? How are you able to encourage GPs to be a bit more consistent in that?
Oh, that's a difficult one. Because I totally get it and understand, because there is an app. There's too many apps sometimes, and I feel like they need to be consolidated into one. It would make it more user friendly. Why not just stick it in the NHS app? We're all the NHS. Why start another app? And we constantly see this, don't we, Trish? Like there's PKB, there's everything, isn't there?
Yeah, it's difficult, because at the end of the day, it's difficult to tell GP practices what they should be doing. So, and at the end of the day, it's all about offering people patient choice. So there are nuances, and people have different systems. So and it's something that's just out of our control. Not a lot we can do about it.
Yeah, I suppose for us, helping people with the NHS app. That's just been something that we decided to do. We linked in with a GP practice. We gave it a go. 25 people turned up, and that's how it started. You know, it was 25 people. It was a full-on session, 2 hours. I absolutely worked. You know, I worked my bum off, and so did Sarah. It was so busy, but it was really, really good, rewarding. We did another one. 30 people turned up. We've got some more lined up. You know, it is rewarding, but I suppose I can see the difficulties because I've got to log in for this, I've got to log in for that. I can't remember my password for this. Like, and I can see, and I get, you know, people within the community, I get the frustrations as well. But I can't do anything about it.
On Jess's question though about any resources that we could share, what I will say is on the NHS website there is actually a really useful guide on the NHS app about downloading it and using it, and that's what I mean. We literally don't reinvent the wheel, we just download their leaflets and use those.
Yeah, I think obviously the clientele that come along, you know, they like a piece of paper. I know we're meant to be digital, and they just love a piece of paper. They will take a piece of paper away, they will analyze it, they'll take all that data out, and then they'll come back the next week and say, oh, actually, I want the NHS app now because I've read about it, and they've taken that piece of paper, and that's what they like. You know, so I don't know, it's a difficult one. It's a very good question. And whoever is able to get all the apps together, you know, would be amazing.
There's a campaign call to action before we even finish an hour. But definitely, I think that point around hard copy collateral is really, really important. Certainly when I was a child and the internet was still relatively new, you had all these books and guides and for dummies guides and so on. And you sort of feel there's a massive gap in the market to anyone who wants to be producing some of those these days.
Yeah.
Michael has asked for a bit more information about one-button comp devices, Trish, that you were mentioning, and whether those are suitable to use in the community.
They are definitely suitable to use in the community, and we use them with all of our community teams. So if I give some examples of where they're used, so they're used for our Home First team. So it might be just to call somebody up to remind them to take some medication. We also use it for our physio team, so they can actually do exercises with the patient. We've got healthy eating disorders. They use it. So what we find is it works best where it's a patient that you're going to see regularly over a period of time. Maybe you're going to see them every day a week, or you're going to see them for 10 weeks, once a week. Whatever it is, we find the comp device to be really useful. So I have put a link in the chat to tell you more about the comp website. What we've done as well, what we found as well is we have like processes as well, which if anyone wants us to share those with them as well. So things that you need to check, because of course, if there isn't an EE signal, for example, in that area, then there's no point taking a comp device out. So you have to do some checks. And what we've used them for as well is our talking therapies service have recently used them, because if they've got asylum seekers in a hotel that they need to meet with, sometimes there's safety concerns as well. So it means that they can just put a comp device in the room in the hotel, and then they can meet with asylum seekers via that method. So it's been really a really useful tool to use. And of course, it saves both the patient and the clinician that travel time, so it's saving them the expense of the travel and the time of the travel. So it's been really well received. And like I say, for those people that haven't got the internet, they can use it to make phone calls to their relatives as well. So that's been an added bonus for them. But if you want us to tell, if you want to meet with us and us to tell you more about it, please feel free to get in contact. We can pass on our email addresses if you wanted to contact us.
We've got a lovely chap as well that supports us as well, haven't we, Trish? So yeah, it's a great company. It's a great piece of kit. It's definitely life changing for people as well.
I think the best thing about it is the simplicity of it, because we have tried other devices, but because this is just a one button that they literally turn on, that, you know, they don't have to be, you know, technical, that, you know, we did try another device, I won't name it, but it just didn't work because it was just too complicated for people to install and use, whereas the comp device is just simplicity.
I think, as Karen asked about, do you loan the comp devices out to services, or are they purchased and gifted to the residents that require the support?
So what we do is we cross charge the service for using them, but what they find is that the time and money that they save in travel pays, you know, it's a lot cheaper to use a comp device than keep paying for travel and time, basically. So it's a more cost-effective way for them, and of course it allows them to see more patients in a day because they haven't got that travel time taken out of their day.
Sounds like an absolutely fantastic device and a brilliant recommendation. And I think there's a couple of people who'd love to follow up with you around exactly what those are and how they can be used. It actually asks a really key question. So you're running this really inclusive process. How do you find the technophobes who don't necessarily realise they want to learn?
The ones that are hiding, that again, that goes back to our digital angels, and that's why we go out and we find them and we hunt them down.
Yes, we do, in a nice way, a digital angel way, not a, you know. And I think that's why we sort of called ourselves the digital angels as well, because it's a nicer name, you know. Yeah, and they sort of, you know, they think us as digital, the working digital, that we're going to be techno, you know, like really, you know, the language is going to be alien to them. But actually, you know, I think because of our personalities, you know, we can speak to anybody, and like obviously the you know the couple that come to the community library before, they didn't want to use technology at all. They were really, really skeptical about everything. But now they've been able to order their brown bin online. She's, you know, the wife's looking at setting up online banking. The husband's looking at a car. You know, and that's through weekly, you know, discussions, meetings, sitting down with them, showing them stuff, and giving them that piece of paper, you know, to take away, digest it, and come back the next week and say, actually, I want a slice of this. I want to be able to get digital. I want to feel safe though online. And I think that's been a real key for us is, you know, we do cybersecurity for staff, and we're starting, you know, that journey. But actually, in the community, it's much needed as well. We need to protect our families, you know, friends, communities, to keep them safe, because there's so many scams out there. And I think, you know, for people that came along that, I haven't got an email address, and we've helped them set up an email address, and then it's the aftercare then, isn't it? You know, if you buy a new car, you want the aftercare. We set you up with an email address, and we don't just dump and run and say, oh, we'll see you later. You know, we educate them and give them, you know, materials to stay safe online, and that's been real key for us.
Which is so important, because it's not just about the digital skills in the sense of, can you turn it on, can you connect, can you find the internet? It's how do you use that safely? How do you protect your own well-being online as well? So it's fantastic to hear that that's something you're just naturally building in as a part of that process as people go along. We've got a couple of questions around some of the practicalities, as they really sort of do tie into the digital poverty aspect of this. So Joe asks, when supporting people in the community to download apps, whether that's the NHS app or indeed anything else, do you sometimes find that people have phones that are too old to be compatible, don't meet the security requirements, don't have the memory? How do you help with that?
So, because we've got devices that we can recycle, so we've got devices in the trust that are out of date that we get wiped and we can recycle those. So we could, if they did have, I mean, we have had, haven't we, service users who have got really old devices, and we've just gone, do you know what? Have one of our recycled devices. SIM cards don't cost them anything again because we won the bid from the Good Things Foundation. So we can give out free SIM cards as long as they're in digital poverty, so that they can make free phone calls for 6 months. They get free phone calls, don't they? And then the comp devices as well, when we give those out, there's no cost at all to the service user. That's just a cost that the trust takes. But in a way, we kind of win because, like I say, we don't have all that, the travel time, and the clinicians have got more time to do more appointments because they haven't got that travel as well. So from that point of view, there's lots of ways we can help service users. We've also kind of directed them to initiatives where we know that they can get a free device with a free SIM card built in as well from things that we've learned along the way. So we can direct.
We're not allowed to say.
We're not allowed to say, but there's certain directions we can send people in to get a device if they're in digital poverty. There's always a way. There's always someone who can help them. That's what we found.
And I sort of think, obviously, as a trust, we have a duty to recycle. You know, before this, I would hate to think what's going on with the device. You know, it makes me really sad because we've got a lot of kit. They go out of. You know, we can't use them after, is it 4 years old? So we have to refresh our devices. And, you know, we've donated kit to schools, you know, that genuinely don't have the budget for kit. And it's really sad that, you know, some families as well, that, you know, my 2 children, they've got homework online, but there's a lot of families that don't have this equipment. So by gifting tablets and laptops to the schools that can then give them to a family that is really in need, as well as the SIM cards for the data to be able to get online, you know, it's making a real difference because there's a pressure as a parent, you know, to be able to give your child the internet. You know, my son, my daughter, they would not be without the internet. It's like second nature to them. And I try and say, well, we used to have to use dial-up. You know, we wouldn't be able to use the telephone at my mom's house if you're on the internet. And, you know, referring back to that, I always say you don't really know how lucky you are. And, you know, I went into a school to do a talk, and I said to the kids, I said, who's got an iPad? Who's got a phone? And they all put their hands up. And I just said, do you know that you're really lucky? Because there are some children that don't have that. And they're like, oh, their faces, they were so shocked. They were like, what? They don't have tablets and phones and the internet. And I'm like, yeah. I was like, you don't realize how lucky you are. And, you know, like giving back to the community, that's what we want to do. You know, we've gifted well over 300 SIM cards and over 300 pieces of equipment, you know, whether it be to Free IT Stafford, schools, things like that. It's just to try and get the kit out there to people that need it, those people that are actually in digital poverty, and trying to get them online.
Absolutely. And we did some work with Deloitte actually around the scale of digital poverty within the UK. I'm just picking up what you were saying there around children. Data that they were able to pull together from official government sources, so ONS data, particularly Ofcom data, did show that at least 20% of children, so 1 in 5 children, do not have a device that they can use for learning at home. And that's a huge number when you really think about 1 in 5 children who can't be doing homework from home. And we know from our own schemes that are massively oversubscribed just how many, well, thousands of parents applying to us, but millions of families across the country do have that need and really want to be able, as you say, as parents, to provide the internet for their children, for their education, for their future. But it's not free. There's a lot of, it's not just buying the device, there's the monthly costs as well. And tackling this all at the heart of what we're all doing.
They're our future. You know, they are our next generation. They are our future. And, you know, as a parent, you want to give them the best start in life. You know, sometimes you might go without being a parent to give to your child. But I just think this day and age, everybody should have the internet. It's, you know, I know the cost of living, people are struggling, but you know, as a government or whoever, we should be able to provide that. That's basic, really, for everybody, really.
It really truly is, and it is now, we believe it's an essential utility, and it has to be a basic right to be able to access the internet. With so many services being moved online, it's just not a luxury anymore. We've got time for just another couple of questions. I feel like Trish and Lucy are probably quite happy to try and put some answers in to the ones that we're not going to have the time to cover in the session. Violet has asked a really interesting question around individuals who perhaps are coming online really for the first time. Are they concerned about how their data is being used by some of the companies that they're maybe signing up with? Is that something that crops up? Do they ask you about it?
Yeah, they do.
I think there's a lot of people are scared as well of the potential pitfalls of cyber crime, things that can happen to them. But that's one of the things we're trying to do as well, is educate people out in the community. We've just developed some cybersecurity training for our staff, which not only looks at staying safe at work, it looks at staying safe in general life and things you do, and gives examples of the pitfalls and things that people can fall for. I've even learned some stuff myself from writing the training. It's quite amazing what's going on and what's happening out there, and how easy it is to click on something and fall for something. We do see a lot of fear, don't we, in the service users that we train. And so we're starting now, again, we're picking up free leaflets and things from the internet, printing those off, taking those out with us, to how people can stay safe online. Because I think that's one, as well as not being able to afford technology, the other barrier is people being scared of it, and understandably, with what's happening with cybercrime at the moment. So it is something that people are very aware of at the moment.
And you know, there's some great stuff online. We've used it from the National Cybersecurity website. It's really good. I can put the link in the chat. They've got some really good visual leaflets, a lot of stuff, you know, that they can take away, they can digest, and then we leave it up to them, if you know, for them to make their own decision. Like, do you want to go online? Okay, this is your bedtime reading. Have a look, digest it, and then come back to us, and then that's your decision then, you know, because I think the target audience may be the older-ish generation, but we do have youngsters that come along as well. You know, from working in a mental health trust, there's people that you know, with mental health issues, that find it hard to trust, and it's very difficult for them, you know, to trust that information. Is it true? You know, are you telling me the right thing? And it's like, well, there you go, there's a leaflet here that's got all the information on there. Take it home, come back, and then we'll get you online.
I've just read John's comment. Totally agree. I think we need to train the MPs as well.
If you can get us there, we'll train them.
Yeah, we'll train them. We'll sort them out. We'll keep the
sort them
country
out.
safe.
I think they need digital angel anyway, don't they? So
Yes, and as well as the political satire point, there actually it really does make a serious point that so many people actually in so many different walks of life just don't have that online savviness, and we maybe see that a little more often than we'd like to in some of our high profile figures, but it's a serious point there as well.
yeah.
And just a very last quick question from Jess around what are the opportunities that you have to be able to share some of your learning actually across different trusts, across other integrated care boards? Do you have the opportunity where you train up others outside your immediate trust as well?
Yeah, so we often get invited to different events to share what we're doing. So yeah, I've presented to our local integrated care board and given them all the information on the things that we're doing locally, because they're very keen to obviously share that out across everybody in the area. Basically, we're happy to go and talk about, we're doing events like this, we're sharing what we're doing as well. So yeah, we're happy to share anything that we're doing, to be honest.
And I also think for me, you know, forms of like Twitter or X or whatever you would call it, LinkedIn, stuff like that.
Yeah.
You know, we try and share as much as possible to show people what we're doing, to showcase the good practice. We learn from other people. I'm always, you know, messaging people going, could we have a conversation to find out what you're doing, you know, and how we're doing it, how you're doing it so well. But as well, there's another hospital within obviously Staffordshire that are also looking at us doing their staff training as well. So to share, you know, the good training that we do. I think it's really important as well to get that word out there, because some people might think, well, who else is doing it? You know, what other trusts are doing it? Because we should all come together and say, look, this is what we're doing. Wow, that's great. You know, can we put a model together and do the same? Because, you know, we're just one small trust, you know, and there's loads of different organizations out there that could actually also be making a difference. You know, but I don't know, it's where to start. It's quite a minefield, isn't it? Where to start. But you know, baby steps, and you know, make it happen really.
Thank you so much. You have obviously grown something incredible, whether that started with baby steps or not, it's turned into something truly inspiring. And I know so many people on this session have really enjoyed hearing about how you've approached this, and hopefully everyone's learnt a little bit that they can take back to their own organisation. It is always a challenge to keep these within an hour, and we always promise that we will. So sorry to anyone whose questions we've not been able to answer, but we will make sure that we share those with Lucy and Trish to come back to you separately. Do visit digitalpovertyalliance.org to also take a bit of a look at some of the work that we've been doing. Read our national delivery plan. The first iteration was launched last year in May at the House of Lords, and very excitingly in June we will be launching our 2024 edition. So do take a look at that. Do take a look at our research that I alluded to with Deloitte, which also talks around how 24,000 lives a year for older people could be saved by exactly the kind of health literacy and digital literacy that Lucy and Trish have been talking about today. And if you like what we're doing, do remember we are a charity, so we would love your donations. We would love if you represent a corporate organisation. We'd love you to think about joining as a corporate member. And if you have old kit lying around, whether it's 3 laptops or 3,000 laptops, please do get in touch, because we can get those wiped, refreshed, and into the hands of families and households who need them. Thank you very much again, Lucy and Trish, and thank you so much to all of our attendees today, and we will see you again soon. Take care.